Hi viewers, this is your host Nurse Rosen Odhiambo on Skills versus the Midwife. Welcome back to our another session. In this video we are going to learn about good positioning and attachment during breastfeeding. So all our mothers out there can learn one or two skills in terms of breastfeeding our babies. Now with me I have a structure of the breast, but before we go into that we want to remind ourselves on the importance of breastfeeding. Number one, bonding. It's good for the mother to breastfeed so that can enhance the bonding between the mother and also the child. Number two, the breast milk has a lot of nutrients that the baby requires for growth, and also it has protective mechanism, and therefore it will make this baby protected from all the microorganisms, and therefore the baby will grow with a good immunity. And also breastfeeding will enhance involution of the uterus because of the production of oxytocin hormone. Therefore the uterus will continue contracting by the day and go back to its pre-pregnant state. And finally, through breastfeeding we can actually use that as a family planning method we call lactation amenorrhea, and therefore this woman is not likely to get pregnant when she is actually exclusively breastfeeding. Having that in mind, so what do we actually need to have, what understanding do we need when we are actually having our babies breastfed? Let's start with good positioning. So this is my baby, and when you want to position the baby properly, first of all, you yourself as the mother, make sure that you have a good sitting position and you're comfortable and relaxed, and you're also not anxious at all. And once you sit down, this is how you put your baby. So make sure that the whole body of the baby is lying straight and it is supported, the head of the baby at the elbow joint, and the rest of your arm is actually supporting the whole of the baby's body. And then this baby has to be put facing the mother, and therefore the nose directly facing the nipple, and also this other part of the body, make sure that it's also very close to the mother, and the tummy facing directly to the mother's tummy. And once you ensure that the whole body of the baby is facing the mother, then make sure it is also well supported. So that is positioning. Let's talk about attachment. So what are some of the good signs of attachment of the baby to the breast? Number one, so once you're ready, the baby has been positioned in readiness to breastfeed, then the mother will actually make sure that, or ensure that the baby's mouth is wide open. So the baby's mouth has to, open widely in readiness to pick the nipple, and also the chin of the baby is touching the breast of the mother. And then as the baby picks the breast, the mother should also ensure that the lower lip is actually turned outward, and the upper portion, or the areola, is actually visible more on the upper or the surface above compared to the surface below. So we should not see more areola below, we should see more areola on the upper surface of the breast. And this is just the structure that shows us how the areola is. Okay, is normally darkened in color, all right, and therefore it should be visible more above and not below, all right. Then once that happens, then make sure that the breast, okay, the nipple is actually touching the upper lip of the baby, and this is to wait. The mother is supposed to wait and target. As soon as the baby opens the mouth, then the mother will directly or quickly place the nipple in the baby's mouth. Okay, so how do you attach? Just make sure that the baby has opened the mouth, and that is done by touching the upper lip, so that once it opens, then the mother will directly put the breast quickly so that the baby can pick it up and start breastfeeding. So what are the signs of effective breastfeeding? Number one, the baby will be taking the breast milk slowly and having deep sucks. And sometimes the baby can be pausing as it is breastfeeding. And also when you look at the baby's chin, it will be rounded, okay? The baby's chin will be rounded. And once the baby is satisfied, it will automatically release the breast. So when you're able to observe all those signs, then you are sure. And of course, when you're doing all these, you're seated and you're relaxed and you're supporting the baby adequately, all right? And you're also looking at the baby face to face. That enhances a lot of bonding between the mother and the baby. So then there are complications that can actually occur if the breast positioning and attachment is not well done, and some of this will include breast engorgement. We can also have mastitis, and also we can have cracked nipples, and especially when the baby does not pick the nipple properly. And just a reminder to us, if the mother does not have adequate milk, then it will be prudent for her to seek medical advice or medical care, so that she can be given alternative ways of feeding the baby. So there are alternative ways that can also be explored. And so much to that, we have learned something today, and I hope we can be teaching our mothers wherever they are, in the clinic, in the wards, and also when we meet them back at home or in the villages where we live. Feel free to put in your questions in the comment section, and any other comment, we will be able to address them accordingly. Thank you very much. See you in the next video.